Hi, I am Dr. Nilesh Makwana, physiotherapist from Mumbai. Let's see some of the ankle joint specific special test. This is the anterior drawer test. This basically tests the anterior talofibular ligament. This ligament is placed exactly over there where my finger is, and when you're moving you can actually feel the tight band which is just below the fibular malleolus. So to do the test, you need to hold the distal end. You grab the calcaneum and support with your forearm and slide it anteriorly, which has to be a little forceful so that you can see the movement happening at the ankle joint. So if there is a sulcus sign, or if there is a pain, or there is a depression, which means it is a positive test for the anterior talofibular ligament. This is an alternative test for anterior talofibular ligament. To do that, and if anterior drawer test is not possible, to do that you need to hold the foot and don't allow the movement, basically no movement, and with the other hand you slide the tibio and fibular joint posteriorly. You actually mimic the same movement what you do in anterior drawer test. Similarly, if there is a sulcus sign or any depression or pain, or there is a large amplitude, it means the test is positive for anterior talofibular ligament. Next test is a Talar tilt test for the inversion. This basically measures the integrity and the injury at calcaneofibular ligament, which is placed there. To do that, you have to hold the distal end, right, and you slowly move the foot in plantar flexed and inversion. So you actually stretch the calcaneofibular ligament while doing this. If there is a pain or discomfort or stretch pain, that means the calcaneofibular ligament is injured and this test is positive. The only problem is in this test, you also people having anterior talofibular ligament can also have a similar pain and sulcus sign and similar discomfort while doing the movement, for which this is not 100% sensitive. The next test is the Talar tilt test for the inversion. This is a test which measures the medial collateral ligament or deltoid ligament injury. To do that, you need to hold the distal end and stabilize it and move the calcaneum in an eversion position, right? If there is a ligament injury or stretch, there is a pain that uh, that means there is a positive test for deltoid ligament. This is a test for the bifurcate ligament or also calcaneocuboid ligament. To do that, you hold the calcaneum and track the fifth metatarsal. In the depression, you put your thumb and separate and stretch the bifurcate ligament. If there is a pain, that means the calcaneocuboid ligament is injured or it's a positive test. This is one of the syndesmosis test if there is an injury at inferior tibiofibular joint. So to do that, you basically hold the shin gently and you hold the foot and move the foot into an external rotation. So slight dorsiflexion and external rotation. So if there is a separation, right, and if there is a positive sign, so that means there is a pain which is at the inferior tibiofibular joint, which is a positive test. This is another test for the syndesmosis or high ankle sprain. This is done in a weight bearing position. So if there is a high ankle sprain, you ask the patient to do simple dorsiflex or DF lunge. So there is a pain that is present while doing, especially at the end range, right, because there is a separation at the distal end. Next, what you have to do is you have to grab the distal end of the tibiofibular joint and ask the patient to do the same movement. In this movement, if there is a reduction in the pain or if there is no pain, that means the test is positive. Please subscribe my YouTube channel, Nilesh Physio Sutra.